Hello and welcome to our comprehensive guide on upper respiratory infections in kittens. In this first chapter, we'll explore what an upper respiratory infection, or URI, really is, why kittens are so vulnerable, and what signs to look out for early. By the end of this chapter, you'll have a solid foundation for understanding this common but serious health issue in young cats. Kittens are naturally curious, energetic, and playful creatures. They explore everything with their senses, especially smell and taste. This curiosity, while adorable, exposes them to many viruses and bacteria in their environment. Upper respiratory infections are one of the most common illnesses affecting kittens, especially those under 6 months of age. A URI is similar to a cold in humans. It affects the upper parts of the respiratory system, the nose, throat, sinuses, and sometimes the eyes. The most common causes of URI in kittens are viral infections, particularly feline herpes virus and feline calicivirus. Bacterial infections can also play a role, often following a viral infection that has already weakened the kitten's immune system. Kittens with weaker immune systems, either because they are very young, have not yet received vaccinations, or are stressed due to changes in environment, are particularly susceptible. One of the key things to understand is how quickly URIs can spread. In multi-kitten households, shelters, or foster environments, the virus can move rapidly from one kitten to another. This is why early detection is so important. Observing your kitten's behavior and physical condition daily can make a big difference in ensuring a fast recovery. Signs of an upper respiratory infection can vary from mild to severe. Some of the earliest symptoms include sneezing, nasal discharge, and watery eyes. Kittens may appear lethargic, eat less, or seem generally unwell. In more severe cases, you might notice difficulty breathing, coughing, or thick yellow or green nasal discharge. Eye infections can also occur alongside URI, leading to redness, swelling, and even discharge that sticks to the fur around the eyes. It's important to recognize that while a URI might seem minor at first, it can develop into a more serious condition if not managed carefully. Dehydration, pneumonia, and other secondary infections are risks, especially in young kittens. Therefore, early intervention and supportive care are essential. Kittens are incredibly resilient, but they also rely heavily on their caregivers for protection. Ensuring a clean environment, maintaining proper nutrition, and keeping kittens away from sick animals are all crucial preventive measures. Vaccinations play a significant role in reducing the severity and frequency of upper respiratory infections. Discussing a vaccination schedule with a veterinarian will give your kitten a strong start in life. In addition to physical care, emotional support is also important. Kittens who are stressed or anxious may have a harder time fighting off infections. Gentle handling, a quiet space to rest, and regular interaction can help reduce stress and support recovery. Throughout this guide, we'll also discuss treatment options, home care strategies, and how to tell when professional veterinary care is necessary. Remember, while many cases of URI can be managed at home with careful observation, never hesitate to contact a veterinarian if your kitten shows severe symptoms or if you are unsure of their condition. By understanding the basics of upper respiratory infections and taking proactive steps, you can help ensure your kitten grows up healthy, happy, and full of life. This chapter has provided the foundation, the what, why, and early signs. And in the following chapters, we'll dive deeper into identifying symptoms, treatment, home remedies, and long-term prevention strategies. Stay tuned for Chapter 2, where we'll explore the early signs of URI in kittens in greater detail, including subtle changes in behavior, eating habits, and breathing patterns. Recognizing these early signs can make all the difference in preventing complications and ensuring a speedy recovery. Welcome back to our in-depth guide on upper respiratory infections in kittens. In Chapter 1, we discussed what URIs are, why kittens are so vulnerable, and the importance of early detection. In this chapter, we will focus on recognizing the early signs of URI in kittens, because catching the infection early can make a huge difference in treatment and recovery. Kittens, like all young animals, have limited ways of communicating when they are feeling unwell. Unlike adult cats, who might be better at hiding their symptoms, kittens often display subtle changes that can easily be missed. Observant caregivers are essential to spotting these signs early. One of the most common early indicators of a URI is sneezing. While occasional sneezing can be normal, frequent or persistent sneezing is often the first sign of an upper respiratory infection. Watch for sneezes accompanied by nasal discharge. The discharge may start clear and watery, but as the infection progresses, it can become thicker, yellow, or green. Nasal congestion is another early sign. Kittens with a URI might breathe through their mouths if their noses are blocked. This can be subtle at first. You may notice the kitten's nose looking slightly wet or crusty. Pay attention to any unusual breathing sounds, such as snorting or wheezing, especially during sleep. Eye issues often accompany URIs. Watery, red, or swollen eyes can indicate the presence of the infection. Discharge from the eyes, sometimes sticky or crusty, is another key sign. Kittens may squint or paw at their eyes more frequently than usual. In some cases, the infection can lead to conjunctivitis, which requires prompt attention to prevent long-term damage. Changes in behavior are equally important to observe. Kittens with early-stage URI often become less active. They may hide more frequently, sleep longer, or show a reluctance to play. Because kittens are naturally curious and energetic, even a small decrease in activity is worth noting. Loss of appetite or changes in eating habits can also be an early sign. When a kitten's nose is congested, it may have difficulty smelling food, which can reduce its interest in eating. Monitor your kitten closely. Missing meals, eating less than usual, or refusing favorite treats can indicate that something is wrong. Some kittens may show mild coughing or gagging. While this is less common than sneezing or nasal discharge, it can signal that the infection is affecting the throat or lower respiratory tract. Even a soft, intermittent cough should be monitored carefully. Fever and lethargy are often late signs, but they can occur early in more aggressive infections. A kitten with a fever may feel warmer than usual and appear unusually tired or weak. If you notice these symptoms, it is important to contact a veterinarian immediately, as high fever can quickly become dangerous for young kittens. Stress and environmental factors can also influence the severity of early symptoms. Changes in the household, new pets, or poor sanitation in the kitten's living area can exacerbate URI symptoms. Creating a calm, clean, and comfortable environment can help prevent minor infections from worsening. It is important to track symptoms over time. Keeping a daily log of your kitten's sneezing frequency, nasal discharge, eye condition, activity levels, and appetite can help identify trends and inform your veterinarian. Even minor details can be crucial in determining the appropriate treatment plan. While home observation is critical, professional care is sometimes necessary even at the early stages. Your veterinarian may recommend supportive care such as fluids, nutritional support, or medications to reduce viral load or prevent secondary bacterial infections. Early intervention often results in a shorter recovery period and reduces the risk of complications. Finally, remember that each kitten is unique. Symptoms can vary in intensity and presentation. Some kittens may show only mild sneezing and watery eyes, while others may display multiple signs simultaneously. Being attentive and responsive is the key to ensuring your kitten recovers quickly and stays healthy. In summary, the early signs of URI in kittens include sneezing, nasal congestion, eye discharge, reduced activity, loss of appetite, coughing, and sometimes mild fever. Observing these signs and taking prompt action can make a significant difference in the outcome. The goal is to catch the infection before it worsens, so your kitten can receive the care it needs to thrive. In the next chapter, Chapter 3, we will dive into treatment options for kittens with URIs, including home care strategies, medications, and when to seek professional veterinary help. Understanding treatment options is essential for every kitten caregiver, especially in households with multiple young cats, shelters, or foster situations. Welcome back! In Chapters 1 and 2, we explored what upper respiratory infections, or URIs, are in kittens and how to recognize the early signs. Now, in Chapter 3, we will discuss the various treatment options available, ranging from home care strategies to professional veterinary interventions. Understanding how to manage a URI effectively is essential to help your kitten recover quickly and prevent complications. The first and most important principle in treating URIs is early intervention. As we discussed, URIs can progress rapidly, especially in kittens under 6 months old or those with compromised immune systems. Acting early can make treatment simpler, shorten recovery time, and reduce the risk of secondary infections like pneumonia. 1. Home care and supportive treatment. Most mild URI cases in kittens can be managed at home with supportive care. This includes providing a clean, warm, and stress-free environment. Make sure the kitten's bedding is soft and regularly washed, and that the living space is free from drafts or sudden temperature changes. Stress can weaken a kitten's immune system, so creating a calm environment is crucial. Hydration is another critical component. Kittens with URIs often lose appetite or become dehydrated due to nasal congestion and fever. Offer fresh water frequently and consider providing wet food, which is easier to eat and contains additional moisture. Some caregivers even use a shallow dish of water with a syringe or dropper if the kitten is reluctant to drink on its own. Proper hydration supports the immune system and helps clear mucus from the nasal passages. Nutrition also plays a key role. A kitten struggling with a URI may not eat enough, which can weaken its body further. Providing high-quality kitten food that is soft, warm, and aromatic can encourage eating. Sometimes gently warming wet food enhances the smell, stimulating appetite. Frequent, small meals are better than a single large meal for kittens that are congested or lethargic. Steam therapy or humidified air can also help. Breathing in gentle steam can relieve nasal congestion and soothe irritated airways. You can run a humidifier near the kitten's resting area or take the kitten into a steamy bathroom for short periods. Be careful to ensure the kitten doesn't overheat or get wet. 2. Medications and veterinary treatments. While home care is vital, some URIs require medications. Antibiotics may be prescribed if a bacterial infection is present or if there is a risk of secondary bacterial complications. It is important to never give antibiotics without veterinary guidance, as improper use can lead to resistance or harm the kitten. For viral infections like feline herpes virus or calicivirus, antiviral medications or supportive drugs may be recommended. These medications are usually prescribed by a veterinarian and can help reduce the severity and duration of symptoms. Additionally, medications to relieve nasal congestion or soothe eye irritation may be used under veterinary supervision. Eye care is another important aspect. Kittens with URIs often develop conjunctivitis or eye discharge. Cleaning the eyes gently with a soft, damp cloth can prevent crusting and reduce irritation. In some cases, your veterinarian may prescribe antibiotic eye drops or ointments. Always follow dosage instructions carefully to avoid injury or overuse. 3. Monitoring and when to seek veterinary help. Even with mild symptoms, kittens should be closely monitored. Keep track of sneezing frequency, nasal and eye discharge, appetite, energy levels, and breathing. Any sudden changes or worsening symptoms warrant immediate veterinary attention. Seek professional care if you notice any of the following: difficulty breathing or rapid, labored breathing, severe lethargy or refusal to eat for more than 24 hours, thick, colored nasal discharge or persistent coughing, fever above normal kitten temperatures, signs of dehydration, such as dry gums or sunken eyes. Veterinarians may conduct tests to identify the specific virus or bacteria causing the infection, allowing for more targeted treatment. They may also provide fluid therapy, nutritional support, or oxygen therapy for kittens with severe symptoms. Early veterinary intervention can be life-saving, especially for very young or vulnerable kittens. 4. Preventing secondary infections. Kittens with URIs are prone to secondary infections because their immune systems are already compromised. Keeping the environment clean, providing supportive care, and following veterinary advice reduces the risk. Avoid exposing the kitten to other sick animals, and sanitize bedding, food bowls, and toys regularly. 5. Long-term care and recovery. Recovery from a URI is not always immediate. Even after symptoms improve, a kitten may remain slightly tired or have mild congestion for a few weeks. Continue supportive care during this period. Maintain proper nutrition, hydration, and a stress-free environment to ensure complete recovery. Vaccinations are also crucial for long-term prevention. Core vaccines for kittens include those that protect against feline herpes virus and calicivirus, both of which are primary causes of URIs. Discussing a vaccination schedule with your veterinarian ensures your kitten has the best possible defense against future infections. In summary, treatment of upper respiratory infections in kittens is a combination of home care, veterinary intervention, and preventive measures. Mild cases can often be managed at home, while more severe infections require professional attention. The key is early detection, consistent monitoring, and supportive care, including proper hydration, nutrition, and stress reduction. In the next chapter, Chapter 4, we will discuss home remedies and natural care strategies that can complement veterinary treatment, helping kittens recover faster while minimizing stress and discomfort. Understanding these options will empower you to provide the best care for your kitten during a URI episode. Welcome back to our series on upper respiratory infections in kittens. In the previous chapters, we discussed what URIs are, how to identify early signs, and the treatment options, including veterinary care. In this chapter, we will focus on home remedies and natural care strategies that can complement professional treatment and help your kitten recover faster. While these remedies are helpful, remember that they are not a replacement for veterinary advice, especially if the infection is severe. 1. Keeping the environment clean and comfortable. One of the most effective ways to support a kitten with a URI is to ensure a clean, warm, and stress-free environment. Young kittens are especially vulnerable to additional infections, so maintaining hygiene is crucial. Wash bedding, blankets, and toys frequently. Disinfect food and water dishes daily. Keep the living area free of drafts and sudden temperature changes, as cold environments can exacerbate symptoms. Temperature control is important. Kittens with URIs often have difficulty regulating their body temperature, especially if they are very young. Providing a warm, cozy area, such as a soft blanket in a quiet corner, helps reduce stress and conserves energy, allowing the kitten's body to focus on fighting the infection. 2. Steam therapy and humidified air. Steam therapy can be very effective in relieving nasal congestion. Running a humidifier near the kitten's resting area adds moisture to the air and eases breathing. Alternatively, spending a few minutes in a steamy bathroom can help open nasal passages. Place the kitten safely in the bathroom while running hot water in the shower or sink, but ensure the kitten is not directly in hot water or getting wet. Even a few minutes of gentle steam can provide noticeable relief. This is particularly useful for kittens with heavy nasal discharge or difficulty breathing. The added moisture helps loosen mucus and reduces irritation in the nasal passages and throat. Repeat sessions once or twice daily, but monitor your kitten carefully to avoid overheating or excessive humidity exposure. 3. Gentle cleaning of eyes and nose. Kittens with URIs often develop watery or crusty eyes. Cleaning the eyes and nose regularly can prevent discomfort and secondary infections. Use a soft, damp cloth or cotton pad moistened with warm water to gently wipe away discharge. Be sure to use a clean cloth each time to avoid spreading bacteria or viruses. For the nose, gently wipe away any crust or dried mucus. Avoid inserting anything into the nostrils. If discharge is thick, yellow, green, or accompanied by a foul odor, this may indicate a bacterial infection that requires veterinary attention. Regular cleaning helps the kitten breathe more comfortably and reduces irritation. 4. Nutrition and hydration support. Proper nutrition is essential for recovery. Kittens with URIs may lose appetite due to nasal congestion or a mild fever. Offering soft, aromatic, and easily digestible food can encourage eating. Warming wet food slightly enhances its smell, stimulating the kitten's appetite. Serve small, frequent meals throughout the day instead of one large meal. Hydration is equally critical. Dehydration can worsen symptoms and slow recovery. Ensure fresh water is always available. Some kittens may benefit from broths or kitten-safe electrolyte solutions, especially if they are reluctant to drink water. A syringe or dropper can be used carefully to administer fluids for kittens that are very weak or dehydrated. 5. Natural remedies and supplements. Certain natural remedies can support the immune system and alleviate mild symptoms. Chicken or turkey broth, unsalted, plain broth provides hydration, warmth, and encourages feeding. Humid air and steam, as mentioned earlier, helps ease nasal congestion. Herbal remedies. Some mild, kitten-safe herbal remedies may be used to soothe inflammation, but always consult a veterinarian before administering herbs. Avoid essential oils, as many are toxic to kittens. Vitamin support. Veterinarians may recommend kitten-specific multivitamins or supplements to strengthen the immune system. Never give human vitamins or supplements without guidance. 6. Reducing stress. Stress can suppress the immune system, making recovery slower. Keep the kitten's environment quiet and calm. Limit exposure to loud noises, other animals, or excessive handling. Gentle petting, soft talking, and providing cozy hiding spaces help kittens feel secure, reducing stress levels and supporting natural healing. 7. Monitoring progress and knowing when to seek help. Even with home care, close observation is essential. Track symptoms daily, noting changes in sneezing, nasal or eye discharge, appetite, energy levels, and breathing. Seek veterinary care if you notice any of the following: persistent high fever, difficulty breathing or wheezing, severe lethargy or refusal to eat, thick, colored nasal or eye discharge, signs of dehydration. Remember, home remedies are meant to support recovery, not replace professional treatment. Severe infections or secondary complications require immediate veterinary attention. 8. Combining home care with veterinary guidance. The most effective approach often combines home care and professional treatment. For instance, supportive care at home can enhance recovery while medications prescribed by a veterinarian address the underlying infection. This combination improves outcomes, reduces stress, and helps your kitten return to full health more quickly. In summary, home remedies for kittens with URIs focus on comfort, hygiene, hydration, nutrition, stress reduction, and gentle supportive care. Steam therapy, proper feeding, cleaning of eyes and nose, and creating a calm environment all play vital roles. While these methods can significantly aid recovery, they should always complement veterinary guidance, not replace it. In the next chapter, Chapter 5, we will explore preventive measures and long-term strategies to reduce the risk of URIs in kittens. Prevention is always better than cure, and understanding how to protect your kitten from future infections is a key part of responsible pet care. Welcome back to our series on upper respiratory infections in kittens. In the previous chapters, we explored what URIs are, early signs to watch for, treatment options, and supportive home care. Now, in Chapter 5, we will focus on preventive measures and long-term care strategies that can help reduce the risk of URIs in kittens and promote lifelong health. Prevention is always more effective than treatment, and understanding these strategies will help you raise a happy, healthy kitten. 1. Vaccination and immunization. One of the most important preventive measures for URIs is vaccination. Core vaccines for kittens include protection against feline herpes virus and feline calicivirus, which are primary causes of URIs. Vaccines stimulate the kitten's immune system, helping it recognize and fight infections more effectively. Most veterinarians recommend a series of kitten vaccinations starting at around 6 to 8 weeks of age, with booster shots every 3 to 4 weeks until the kitten reaches 16 weeks. Following this schedule ensures that the kitten develops strong immunity during the most vulnerable period of life. Discuss with your veterinarian about any additional vaccines that may be appropriate based on your kitten's environment, lifestyle, and health status. 2. Maintaining a clean environment. Kittens are particularly vulnerable to infections in crowded or unsanitary environments. Keeping your kitten's living space clean, dry, and free of drafts is essential. Wash bedding, blankets, and toys regularly. Disinfect food and water bowls daily to prevent bacteria and viruses from spreading. If you have multiple kittens or other pets, try to isolate new or sick animals until they are confirmed healthy. Shelters, foster homes, and multi-pet households should pay special attention to sanitation, ventilation, and crowding to reduce the spread of respiratory infections. 3. Proper nutrition and hydration. Strong immunity depends heavily on proper nutrition. Feeding your kitten a high-quality, balanced diet supports overall health and helps the body fight off infections. Wet food can also provide additional hydration, which is important for kittens prone to respiratory issues. Hydration plays a crucial role in preventing URIs. Ensure your kitten always has access to fresh water and monitor for signs of dehydration, such as dry gums or lethargy. Proper hydration supports the immune system and helps maintain healthy mucous membranes in the respiratory tract, reducing susceptibility to infection. 4. Reducing stress and providing a safe environment. Stress can weaken the immune system, making kittens more susceptible to infections. To minimize stress, provide a calm and predictable environment. Avoid sudden loud noises, excessive handling, or overcrowding. Create cozy resting areas where the kitten can feel secure and relaxed. Socialization is important, but should be done gradually. Introducing new people, pets, and experiences slowly allows the kitten to adapt without overwhelming its immune system. A stress-free environment enhances overall health and strengthens the kitten's natural defenses against URIs. 5. Regular veterinary checkups. Routine veterinary visits are a cornerstone of preventive care. Even if your kitten appears healthy, regular checkups allow the veterinarian to monitor growth, detect early signs of illness, and ensure vaccinations and deworming are up to date. During these visits, your veterinarian can provide guidance on proper nutrition, behavior, and environmental factors that reduce the risk of URIs. Early detection of any health issue, even minor, can prevent complications and improve long-term outcomes. 6. Hygiene practices and handling. Proper hygiene when handling kittens is essential to prevent the spread of infections. Wash your hands before and after touching your kitten, especially if you are caring for multiple animals. Limit contact with stray or unknown cats, as they may carry viruses or bacteria that can cause URIs. If a kitten shows signs of illness, isolate it from healthy animals and maintain strict cleanliness of bedding, feeding dishes, and toys. Use disposable or separate cleaning tools for sick kittens to prevent cross-contamination. 7. Monitoring and early intervention. Even with preventive measures, URIs can still occur. The key to minimizing complications is early intervention. Observe your kitten daily for signs of sneezing, nasal discharge, watery eyes, or changes in appetite and behavior. Quick action, including home care or veterinary attention, can prevent a minor URI from becoming severe. Keeping a health journal is useful. Record symptoms, feeding patterns, and any changes in behavior. This information can be invaluable for your veterinarian when assessing your kitten's health and planning treatment if needed. 8. Strengthening the immune system naturally. A strong immune system is the best defense against URIs. In addition to vaccines and proper nutrition, some natural strategies can help. Provide adequate sleep and rest, allowing the body to recover and build immunity. Ensure gentle socialization, which reduces stress and promotes mental well-being. Avoid exposure to environmental toxins, such as cigarette smoke, strong chemicals, or heavily scented products. Maintain a clean and dry environment, as damp or dirty spaces encourage the spread of viruses and bacteria. These strategies support your kitten's natural defenses, making it less likely for infections to take hold. 9. Planning for multiple cats or shelter environments. If you have multiple kittens or pets, extra care is needed to prevent URIs. Proper spacing, separate feeding areas, and careful monitoring can reduce transmission. In shelters or foster environments, following strict sanitation protocols, isolating sick animals, and ensuring vaccinations are current are critical steps to protecting the entire group. 10. Long-term care and lifestyle considerations. Preventive care does not end once the kitten grows older. Lifelong attention to health, nutrition, vaccination, and stress management will continue to protect your cat from respiratory infections and other illnesses. Regular checkups, maintaining a clean home environment, and observing your cat for any signs of illness are habits that benefit both kitten and adult cat stages. In summary, preventing upper respiratory infections in kittens involves a combination of vaccination, hygiene, nutrition, stress reduction, monitoring, and veterinary care. By implementing these strategies consistently, you can greatly reduce the risk of URIs and ensure your kitten grows up healthy and strong. Prevention is always better than treatment, and proactive care today can save time, stress, and health complications in the future. In the next chapter, Chapter 6, we will discuss common complications of URIs in kittens, including how to recognize them early and prevent serious outcomes. Understanding potential complications is key to providing timely care and protecting your kitten's long-term health. Welcome back to our detailed series on upper respiratory infections in kittens. In the previous chapters, we discussed what URIs are, early signs, treatment, home care, and preventive measures. In this chapter, we will focus on common complications of URIs in kittens, how to recognize them early, and strategies to prevent serious health issues. Understanding complications is crucial because while most URIs are mild, they can sometimes lead to more severe conditions if not managed carefully. 1. Secondary bacterial infections. One of the most common complications of a URI is a secondary bacterial infection. Viral infections like feline herpes virus or calicivirus can weaken a kitten's immune system, making it easier for bacteria to invade. Secondary infections often affect the respiratory system, leading to more severe symptoms such as thick yellow or green nasal discharge, persistent coughing, or worsening lethargy. Preventing secondary infections involves early detection and proper hygiene. Cleaning bedding, food dishes, and litter boxes regularly, as well as isolating sick kittens from healthy ones, can reduce the risk. Additionally, monitoring symptoms closely and consulting a veterinarian if discharge changes color or becomes thick helps ensure timely treatment with antibiotics when necessary. 2. Pneumonia. Pneumonia is a more serious complication that can occur if a URI spreads to the lower respiratory tract. Kittens with pneumonia may show rapid, labored breathing, wheezing, coughing, and severe lethargy. They may also refuse to eat or drink, which can quickly lead to dehydration and weakness. Early recognition is essential. Any kitten showing signs of labored breathing should be taken to a veterinarian immediately. Treatment typically involves supportive care, oxygen therapy, and sometimes antibiotics or antivirals. Preventing pneumonia includes keeping kittens warm, hydrated, and stress-free, and addressing URIs promptly before they progress. 3. Conjunctivitis and eye complications. Kittens with URIs often develop eye infections, including conjunctivitis. Left untreated, these infections can cause significant discomfort and may lead to more serious problems, such as corneal ulcers or scarring. Early signs include redness, swelling, watery or sticky discharge, and frequent pawing at the eyes. Regular eye cleaning with a soft, damp cloth can prevent irritation and remove discharge. In some cases, veterinary-prescribed eye drops or ointments are necessary. Prompt treatment reduces the risk of long-term damage and helps kittens maintain clear vision. 4. Dehydration and malnutrition. URIs can cause kittens to lose appetite or have difficulty eating due to nasal congestion and loss of smell. If left unaddressed, this can lead to malnutrition and dehydration, weakening the kitten further and slowing recovery. Providing wet, aromatic food and ensuring constant access to fresh water are essential. In severe cases, your veterinarian may recommend fluid therapy or syringe feeding. Maintaining proper hydration and nutrition is key to preventing this complication and supporting the immune system. 5. Chronic or recurrent infections. Some kittens may experience chronic or recurrent URIs, particularly those with weakened immune systems or underlying health issues. Recurrent infections can lead to persistent nasal and eye discharge, coughing, and reduced overall health. Preventing recurrent URIs involves maintaining up-to-date vaccinations, proper nutrition, stress reduction, and avoiding exposure to sick animals. Monitoring your kitten's health and seeking veterinary guidance early can minimize the risk of recurring infections. 6. Ear infections. URIs can sometimes lead to ear infections if bacteria spread from the nasal passages or throat to the ears. Signs include scratching at the ears, head shaking, redness, or discharge. Ear infections can be painful and, if untreated, may result in long-term damage. Regular monitoring and veterinary care are crucial. Ear infections may require cleaning, antibiotics, or other medications prescribed by a veterinarian. Preventive care, including maintaining a clean environment and addressing URIs promptly, reduces the likelihood of ear complications. 7. Impact on growth and development. Severe or prolonged URIs can impact a kitten's growth and development, particularly in very young kittens. Chronic illness, poor appetite, and dehydration can slow weight gain and affect overall physical and immune development. Early intervention, proper nutrition, and supportive care help mitigate these risks. Ensuring kittens receive regular veterinary checkups, vaccinations, and a clean, stress-free environment supports healthy growth and long-term well-being. 8. Prevention strategies for complications. Preventing complications starts with early detection and treatment of URIs. Key strategies include observing kittens daily for changes in sneezing, nasal discharge, eye condition, and behavior. Maintaining hygiene in living spaces, bedding, and feeding areas. Providing proper nutrition and hydration. Reducing stress and providing a calm, safe environment. Keeping vaccinations up to date. Seeking veterinary care promptly for severe or worsening symptoms. By following these strategies, many complications can be avoided, and kittens can recover more quickly and fully from URIs. 9. When to seek immediate veterinary care. While mild URIs can often be managed at home with supportive care, some situations require immediate veterinary attention. Severe or labored breathing. Persistent high fever. Refusal to eat or drink for more than 24 hours. Thick, colored nasal or eye discharge. Signs of dehydration or weakness. Rapid deterioration in behavior or energy levels. Timely intervention can prevent life-threatening complications and ensure your kitten receives the care it needs. 10. Long-term health and monitoring. Even after recovery, it's important to monitor your kitten's health over time. Some kittens may remain more susceptible to respiratory infections, especially in multi-pet households or stressful environments. Keeping a record of past infections, vaccinations, and any chronic symptoms helps your veterinarian provide the best long-term care. Regular checkups, a balanced diet, stress reduction, and a clean environment continue to play important roles in maintaining your kitten's respiratory health. Prevention, combined with early intervention, is the key to ensuring a happy, healthy life for your kitten. In summary, upper respiratory infections in kittens can lead to serious complications if not managed carefully. Common complications include secondary bacterial infections, pneumonia, eye problems, dehydration, recurrent infections, ear infections, and impacts on growth. Early detection, supportive care, proper hygiene, nutrition, and veterinary guidance are essential to preventing these complications. By being vigilant and proactive, caregivers can help their kittens recover fully and enjoy a healthy, thriving life. In the next chapter, Chapter 7, we will explore recovery and rehabilitation strategies for kittens after a URI, including step-by-step guidance to restore strength, immunity, and overall well-being. Welcome back to our comprehensive series on upper respiratory infections, or URIs, in kittens. In the previous chapters, we discussed the causes, early signs, treatment options, home care strategies, preventive measures, and common complications. Now, in Chapter 7, we focus on recovery and rehabilitation. Helping your kitten regain full health after a URI is just as important as treating the infection itself. Recovery involves physical care, nutrition, mental well-being, and long-term preventive strategies. 1. Understanding the recovery process. Recovery from a URI is not always immediate. Even after symptoms improve, kittens may remain slightly lethargic, have mild congestion, or show reduced appetite for several days to a few weeks. It's important to monitor your kitten closely during this period, providing supportive care and ensuring a smooth transition back to full health. Recovery is gradual. Some kittens bounce back quickly, while others may require extended support, especially if they experience severe symptoms, dehydration, or complications. Patience and consistent care are essential. 2. Nutrition during recovery. Proper nutrition plays a pivotal role in rebuilding strength and immunity. Kittens recovering from a URI may have reduced appetite or sensitivity to certain foods, so offering highly palatable, nutrient-rich food is key. Wet kitten food, warmed slightly to enhance aroma, can encourage eating. Frequent small meals are preferable to a single large meal. Provide a variety of textures and flavors if your kitten is reluctant to eat. Including food rich in high-quality proteins, vitamins, and minerals supports immune function, tissue repair, and overall growth. Hydration remains essential even after acute symptoms subside. Continue offering fresh water at all times, and consider supplementing with kitten-safe broths or fluids if your veterinarian recommends it. Dehydration can hinder recovery and prolong weakness. 3. Supporting the respiratory system. Even after symptoms improve, kittens may still have slightly congested nasal passages or mild coughing. Gentle steam therapy or the use of a humidifier in the kitten's resting area can continue to support respiratory health. Encourage the kitten to rest in a calm, warm environment, free from drafts and excessive noise. Limiting activity during the first few days of recovery helps conserve energy for healing. 4. Eye and nasal care. Kittens that experienced eye discharge or crusting during a URI may still have residual irritation. Continue to gently clean the eyes and nose with a soft, damp cloth as needed. Persistent or worsening symptoms should prompt a follow-up visit to the veterinarian. Proper hygiene reduces the risk of secondary infections and ensures comfort during recovery. 5. Gradual return to normal activity. As the kitten regains strength, you can gradually reintroduce normal play and exploration. Start with short play sessions and low-intensity activities, monitoring for any signs of fatigue, coughing, or labored breathing. Avoid overexertion during recovery. Kittens are naturally energetic, but pushing them too soon can stress the respiratory system or weaken immunity. Gradually increasing activity over several days or weeks ensures safe rehabilitation. 6. Monitoring weight and growth. URIs can temporarily impact a kitten's appetite and growth. It's important to track weight gain during recovery. Regularly weigh your kitten and ensure it is gradually returning to its expected growth curve. Slow or stagnant growth may indicate lingering health issues, nutritional deficiencies, or unresolved infection, warranting veterinary attention. 7. Immune system support. A kitten's immune system may still be vulnerable after a URI. Continuing balanced nutrition, proper hydration, and stress-free care help strengthen immunity. Some veterinarians may recommend specific supplements to support immune function, but always follow professional guidance to ensure safety and effectiveness. 8. Preventing reinfection. Even after recovery, kittens are susceptible to reinfection, particularly if exposed to other sick animals or contaminated environments. Maintain a clean living space, isolate new or unvaccinated animals, and avoid high-risk areas during the recovery period. Keep up with vaccinations as recommended by your veterinarian. This not only prevents URIs but also protects against other infectious diseases, promoting long-term health and resilience. 9. Emotional support and bonding. Recovery isn't just physical. Kittens also benefit from emotional support. Gentle petting, calm talking, and supervised play help reduce stress, encourage appetite, and strengthen your bond. A secure, nurturing environment allows your kitten to feel safe and accelerates overall recovery. 10. Follow-up veterinary care. Even if your kitten seems fully recovered, a follow-up visit can ensure that the infection has completely resolved and that no complications have developed. Your veterinarian can check for lingering respiratory issues, eye or ear infections, and overall health. Regular veterinary checkups also provide an opportunity to discuss long-term preventive care, including vaccination boosters, nutritional guidance, and early detection of any potential health concerns. 11. Recognizing subtle lingering symptoms. During recovery, watch for subtle signs that may indicate incomplete healing. Mild sneezing that persists beyond a week or two. Occasional watery or sticky eye discharge. Reduced energy or playfulness compared to usual behavior. Slight congestion or labored breathing during activity. Addressing these signs promptly prevents minor issues from becoming major complications. 12. Building healthy habits for the future. Finally, use the recovery period to establish healthy routines that support long-term wellness. Consistent feeding schedules with high-quality nutrition. Regular hydration and access to clean water. A calm and safe environment for rest and play. Routine hygiene for bedding, toys, and living areas. Scheduled veterinary checkups and vaccination boosters. These habits not only help your kitten recover fully from a URI but also build resilience against future infections and health challenges. In summary, recovery and rehabilitation after a URI require patience, supportive care, nutrition, hydration, monitoring, and veterinary guidance. Ensuring a calm environment, proper feeding, gentle respiratory support, and emotional care accelerates healing and strengthens the kitten's overall health. By following these strategies, caregivers can help their kittens return to full energy, enjoy normal growth, and build a strong immune system to prevent future illnesses. In the next chapter, Chapter 8, we will explore special considerations for kittens in shelters, foster homes, and multi-cat households, including strategies for managing URIs in group settings and preventing outbreaks. Understanding these dynamics is essential for anyone caring for multiple young cats. Welcome back to our in-depth series on upper respiratory infections, or URIs, in kittens. In the previous chapters, we explored what URIs are, how to detect early signs, treatment options, home care strategies, preventive measures, and recovery. In Chapter 8, we focus on managing URIs in shelters, foster homes, and multi-cat households. These environments present unique challenges, as the risk of infection spreading is higher due to close contact, shared spaces, and stress factors. 1. Understanding the risks in group settings. Kittens in shelters, foster homes, or multi-cat households are at increased risk for URIs because close proximity allows viruses and bacteria to spread quickly. Shared food, water, and bedding can harbor infectious agents. Stress from new environments or frequent handling weakens the immune system. Mixed vaccination status among kittens may leave some more vulnerable. Recognizing these risks is the first step in preventing outbreaks and managing infections effectively. 2. Early detection and isolation. Early detection is critical in group settings. Staff or caregivers should monitor each kitten daily for signs of sneezing, nasal or eye discharge, coughing, lethargy, and reduced appetite. Quick identification allows for rapid intervention before infections spread. If a kitten shows symptoms of a URI, immediate isolation is necessary. Provide a separate area with its own bedding, food, water, and litter box. This prevents the infection from reaching healthy kittens and reduces stress on the sick kitten. 3. Hygiene protocols and sanitation. Maintaining strict hygiene is essential in group environments. Key practices include daily cleaning and disinfecting of cages, bedding, litter boxes, and feeding areas. Separate cleaning tools for sick and healthy kittens to prevent cross-contamination. Proper hand washing before and after handling kittens. Using disposable gloves or dedicated clothing when caring for sick kittens can further reduce the spread of infection. High standards of sanitation not only protect kittens but also reduce the overall incidence of URIs in the facility. 4. Nutrition and hydration in group settings. Ensuring each kitten receives adequate nutrition and hydration is crucial. Sick kittens may be reluctant to eat, especially when other cats are nearby. Provide individual feeding areas and soft, aromatic food to encourage appetite. Hydration should be closely monitored. In multi-cat households or shelters, kittens may compete for water or food, so offering multiple sources ensures that even the weakest kitten can access what it needs. Proper nutrition and hydration support immune function and speed recovery. 5. Stress reduction strategies. Stress is a major factor that exacerbates URIs in group environments. Techniques to reduce stress include quiet, low-traffic areas for sick or recovering kittens, separate hiding spaces with soft bedding for comfort and security, gentle handling and limited exposure to loud noises or sudden activity. Reducing stress helps the kitten's immune system fight off infection and prevents illness from spreading due to weakened defenses. 6. Vaccination and preventive health. Vaccination is a cornerstone of preventing URIs in multi-cat environments. Ensure that all kittens are up to date on core vaccines, especially those protecting against feline herpes virus and calicivirus. In shelters or foster homes, maintain records of vaccination status and exposure history. Vaccinated kittens are less likely to develop severe infections and are less likely to transmit viruses to others. 7. Monitoring and record keeping. Detailed monitoring and record keeping are vital. Track symptoms in each kitten, including sneezing, eye or nasal discharge, coughing, and lethargy. Food and water intake. Weight and growth. Medication administration and response to treatment. Records allow caregivers to detect patterns, identify early outbreaks, and coordinate care efficiently. They also help veterinarians make informed decisions about treatment and prevention. 8. Treatment and veterinary care in group environments. In multi-cat settings, some kittens may require veterinary treatment, including medications or supportive care. Work with a veterinarian to develop a protocol for treating sick kittens, including isolation procedures, medication schedules, monitoring for side effects or complications, criteria for returning recovered kittens to group areas. Having a clear plan ensures consistent care and prevents the spread of infection. 9. Environmental management. Managing the environment is key to controlling URIs. Strategies include adequate ventilation to reduce airborne viral particles, regularly cleaned litter boxes to prevent bacterial buildup, spacing kittens appropriately to reduce stress and limit transmission, soft bedding and cozy hiding spots to promote comfort and rest. Even simple measures, like spacing cages slightly apart or providing multiple resting areas, can significantly reduce infection risks. 10. Long-term strategies for multi-cat health. Preventing URIs over the long term involves consistent, ongoing practices. Maintain up-to-date vaccination schedules for all cats. Monitor for early symptoms daily. Enforce strict hygiene protocols consistently. Reduce stress through environmental enrichment and careful handling. Isolate sick animals promptly. Regularly consult with veterinarians for updates on best practices. By combining vigilance, hygiene, nutrition, vaccination, and stress reduction, caregivers can create an environment where kittens thrive and URIs are minimized. 11. Educating staff and foster caregivers. In shelters and foster networks, educating everyone involved is critical. Training should cover recognizing early signs of URIs, proper cleaning and disinfection methods, isolation and quarantine procedures, monitoring and record keeping, when to seek veterinary intervention. Educated caregivers are empowered to prevent outbreaks and provide effective care for sick kittens. 12. Summary. Managing URIs in shelters, foster homes, and multi-cat households requires a multifaceted approach. Early detection and isolation of sick kittens, strict hygiene and sanitation, adequate nutrition, hydration, and stress reduction, up-to-date vaccinations and preventive health care, detailed monitoring and record keeping, education of all caregivers. By implementing these strategies, caregivers can reduce the spread of infections, support the health and recovery of sick kittens, and create a safe environment for all animals in group settings. In the next chapter, Chapter 9, we will explore special considerations for very young or high-risk kittens, including neonates, kittens with compromised immunity, and those recovering from severe URIs. Understanding these considerations is critical for ensuring survival and healthy development in vulnerable kittens. Welcome back to our comprehensive series on upper respiratory infections, URIs, in kittens. In the previous chapters, we explored the causes, symptoms, treatment, home care, preventive measures, recovery, and multi-cat management strategies. In Chapter 9, we will focus on special considerations for neonatal and high-risk kittens. These kittens are particularly vulnerable due to their immature immune systems, and extra care is needed to ensure survival, recovery, and healthy development. 1. Understanding neonatal and high-risk kittens. Neonatal kittens, defined as those under 4 weeks of age, have underdeveloped immune systems and rely heavily on maternal antibodies from colostrum for protection. High-risk kittens include premature or underweight kittens, orphans without access to mother's milk, kittens with underlying health issues, such as congenital defects or compromised immunity, kittens from shelters or multi-cat environments where infection exposure is high. Because their immune systems are immature, even mild URIs can escalate quickly in these kittens, making early detection and proactive care critical. 2. Early recognition of URIs in neonates. Recognizing URIs in neonatal kittens can be challenging because they may not show obvious symptoms. Watch carefully for subtle signs, including weak or irregular suckling, nasal congestion that makes breathing difficult, sneezing, coughing, or gurgling sounds, lethargy or reluctance to move, watery or crusty eyes, difficulty gaining weight. Frequent monitoring is essential. Any deviation from normal behavior, appetite, or growth should prompt immediate attention. 3. Environmental considerations for vulnerable kittens. Neonatal and high-risk kittens require a warm, stable, and stress-free environment. Key considerations include temperature control. Neonates cannot regulate body temperature effectively. Provide a heated pad or warm blankets, but ensure there is a cooler area so the kitten can move if it becomes too warm. Humidity. Using a humidifier can help reduce nasal congestion and ease breathing. Cleanliness. Sanitize bedding, feeding equipment, and nesting areas regularly to minimize infection risks. Minimizing stress. Handle kittens gently, avoid loud noises, and limit exposure to other animals. Maintaining these environmental factors supports immune function and overall health. 4. Nutrition and feeding challenges. Proper nutrition is crucial for neonatal and high-risk kittens. Most depend entirely on mother's milk or formula, as solid foods are not suitable at this age. Key points include: use kitten-specific milk replacers if the mother's milk is unavailable. Avoid cow's milk, which can cause digestive upset. Feed small, frequent meals to prevent hypoglycemia and ensure proper growth. Maintain clean feeding equipment, including bottles and nipples, to prevent bacterial contamination. Kittens struggling with URIs may have difficulty suckling. In such cases, careful assisted feeding using syringes or specialized feeding tools may be necessary, following veterinary guidance. 5. Hydration support. Dehydration can develop rapidly in neonatal and high-risk kittens with URIs. Signs of dehydration include sunken eyes, dry or tacky gums, weakness or lethargy, poor skin elasticity. To prevent dehydration, ensure kittens receive adequate fluid intake through feeding. In some cases, subcutaneous or intravenous fluids administered by a veterinarian may be required for very ill or weak kittens. 6. Respiratory support. Because neonatal and high-risk kittens have small, delicate airways, respiratory issues can escalate quickly. Supportive care strategies include humidified air or gentle steam to ease congestion, elevating the head slightly during feeding to prevent aspiration, ensuring kittens are in a stress-free environment to reduce respiratory strain. Veterinary intervention is critical if the kitten shows signs of labored breathing, cyanosis, bluish gums, or persistent wheezing. 7. Monitoring growth and weight gain. Daily weighing is essential for neonatal and high-risk kittens. Slow or stagnant weight gain can indicate infection, inadequate nutrition, or other health concerns. Keep detailed records to track weight trends, feeding amounts and frequency, signs of respiratory distress, overall activity and alertness. Regular monitoring allows for early detection of problems and timely veterinary intervention. 8. Infection control in high-risk settings. Kittens in foster homes, shelters, or multi-cat households are at greater risk of contracting URIs. For vulnerable kittens, isolate high-risk or symptomatic kittens from healthy animals. Use separate bedding, food, water, and cleaning tools. Limit exposure to visitors or new animals. Enforce strict hand hygiene among caregivers. These steps are critical to prevent rapid spread of infection and protect fragile kittens. 9. Veterinary support and interventions. Neonatal and high-risk kittens may require specialized veterinary care, including antibiotics or antivirals for bacterial or viral complications, nutritional supplementation, fluids to address dehydration, oxygen therapy for severe respiratory distress. Close collaboration with a veterinarian ensures kittens receive tailored care, maximizing survival and long-term health outcomes. 10. Emotional and social considerations. Even neonatal kittens benefit from gentle human interaction and socialization, which reduces stress and supports mental well-being. However, handling should be limited and gentle, ensuring that kittens are not overstimulated or fatigued. Bonding activities, such as soft talking, gentle petting, and safe exposure to caregivers, help kittens develop trust and adapt to their environment while recovering from illness. 11. Long-term outlook. With timely intervention, proper nutrition, and vigilant care, many neonatal and high-risk kittens recover fully from URIs. However, some may remain more susceptible to future infections, particularly if exposed to crowded or stressful environments. Long-term strategies include continued vaccinations and boosters, maintaining a clean, stress-free environment, monitoring for recurrent symptoms, ensuring proper nutrition and growth. By implementing these measures, caregivers can support vulnerable kittens in achieving healthy development and lifelong resilience. 12. Summary. Neonatal and high-risk kittens require specialized attention when dealing with URIs. Key considerations include early recognition of subtle symptoms, a warm, clean, and stress-free environment, proper nutrition and hydration, gentle respiratory support, isolation from other animals to prevent spread, close veterinary collaboration for monitoring and treatment, emotional support and gentle socialization. With vigilant care and proactive intervention, even the most fragile kittens can recover successfully and thrive. In the next chapter, Chapter 10, we will conclude our series by discussing long-term management, preventive strategies, and lifestyle tips for kittens who have recovered from URIs, ensuring their continued health and vitality. Welcome back to the final chapter of our comprehensive series on upper respiratory infections, URIs, in kittens. Throughout this series, we have discussed the causes, symptoms, treatment, home care, preventive measures, complications, recovery, and special considerations for vulnerable kittens. Now in Chapter 10, we focus on long-term management, preventive strategies, and lifestyle tips to ensure kittens who have recovered from URIs maintain optimal health and remain resilient against future infections. 1. Understanding post-URI vulnerability. Even after a full recovery, kittens may remain slightly more susceptible to URIs, particularly during periods of stress, changes in environment, or exposure to other cats carrying infections. Their immune systems, while strengthened through recovery, may still be developing, and preventive care is essential to minimize the risk of reinfection. Recognizing that a recovered kitten is not automatically immune allows caregivers to implement long-term strategies that support continued health and resilience. 2. Vaccination and booster schedules. Maintaining up-to-date vaccinations is one of the most effective ways to prevent future URIs. Core vaccines for kittens include protection against feline herpes virus, calicivirus, and panleukopenia. After completing the initial kitten vaccination series, boosters are generally required annually or as recommended by your veterinarian. Keeping vaccination records and following veterinary guidance ensures that the kitten's immune system remains strong and prepared to combat infections. 3. Nutrition and immune support. Proper nutrition continues to play a pivotal role in long-term health. Key points include feeding high-quality, balanced kitten or cat food with essential vitamins, minerals, and amino acids. Ensuring adequate hydration at all times. Offering a mix of wet and dry food to encourage hydration and provide nutritional variety. Considering immune-supporting supplements only under veterinary guidance. A well-nourished kitten is better equipped to resist infections and recover quickly if exposed to pathogens in the future. 4. Hygiene and environmental maintenance. Maintaining a clean, sanitary living environment is critical for long-term prevention. Clean bedding, litter boxes, and food/water dishes regularly. Disinfect shared toys and surfaces to prevent bacterial or viral buildup. Provide proper ventilation in indoor spaces to reduce airborne pathogens. Avoid exposure to unknown or stray animals who may carry infections. These practices reduce the likelihood of reinfection and promote overall well-being. 5. Stress reduction and mental well-being. Stress can weaken the immune system and increase susceptibility to URIs. To promote a low-stress environment, offer quiet resting areas with soft bedding and hiding spots. Maintain predictable routines for feeding, play, and care. Provide mental stimulation through toys, scratching posts, and gentle interactive play. Minimize sudden environmental changes or loud noises. A calm, predictable environment supports both physical health and emotional well-being, strengthening long-term immunity. 6. Monitoring health and early intervention. Even recovered kittens should be monitored regularly for any signs of illness. Sneezing, coughing, or nasal discharge. Watery or sticky eyes. Loss of appetite or weight. Lethargy or changes in behavior. Early detection allows for prompt intervention, which can prevent minor issues from developing into severe infections. Keeping a health journal helps track patterns and provides valuable information for veterinary consultations. 7. Preventive measures in multi-cat households. For households with multiple cats, additional strategies reduce infection risks. Separate feeding and resting areas to minimize stress and contact with potentially infectious secretions. Isolate new cats temporarily until their health and vaccination status are verified. Maintain strict hygiene protocols for shared spaces. Limit overcrowding to ensure each cat has adequate personal space. These measures help protect all cats in the household, particularly those who have recently recovered from URIs. 8. Long-term exercise and activity. Regular exercise and play are crucial for overall health. Encourage daily interactive play to build strength and maintain a healthy weight. Provide climbing structures, scratching posts, and toys for mental and physical stimulation. Avoid overexertion immediately after recovery, gradually returning to normal activity levels. Active, engaged kittens have better circulation, stronger muscles, and enhanced immune function, all contributing to long-term resistance to illnesses. 9. Ongoing veterinary care. Routine veterinary visits remain essential for long-term health management. Annual checkups to monitor growth, weight, and overall health. Vaccination boosters and preventive care, such as deworming and flea control. Dental care and general wellness evaluations. Veterinary guidance on diet, supplements, and preventive strategies. Proactive veterinary care ensures that recovered kittens remain healthy, resilient, and less likely to develop complications in the future. 10. Lifestyle tips for a healthy life. Implementing lifestyle habits that support overall wellness is crucial. Maintain a clean and enriched environment. Feed balanced, nutrient-rich diets. Offer safe socialization and gentle handling. Avoid unnecessary stress or exposure to sick animals. Encourage mental and physical stimulation through play and exploration. Long-term lifestyle considerations complement medical preventive strategies and help kittens thrive well into adulthood. 11. Preparing for seasonal and environmental challenges. URIs can become more prevalent during certain times of the year, especially in cold or damp seasons. Protective measures include keeping kittens warm and dry indoors, reducing exposure to cold drafts and sudden temperature changes, ensuring indoor spaces are well ventilated but free from excessive airflow, maintaining vaccination and preventive care to reduce seasonal susceptibility. Awareness and preparation help prevent recurrent infections and protect the health of recovered kittens. 12. Summary and key takeaways. Long-term management for kittens who have recovered from URIs involves a combination of vaccinations and booster schedules to maintain immunity, balanced nutrition and hydration to support the immune system, clean, safe, and stress-free environments, regular monitoring and early intervention for any signs of illness, preventive care in multi-cat settings to minimize reinfection risks, exercise, mental stimulation, and lifestyle habits that promote overall well-being, routine veterinary checkups to ensure optimal health. By following these long-term strategies, caregivers can help kittens not only recover from URIs but also thrive, grow strong, and enjoy a healthy, active, and resilient life. Preventive care, vigilance, and a nurturing environment are key to ensuring that kittens maintain optimal health for years to come. This concludes our comprehensive series on upper respiratory infections in kittens. By understanding the causes, recognizing symptoms, providing proper treatment, supporting recovery, and implementing preventive strategies, caregivers can make a significant difference in the health and well-being of their kittens. Welcome back to our extended series on upper respiratory infections, URIs, in kittens. In the previous chapters, we discussed everything from causes, symptoms, treatment, recovery, and long-term preventive strategies. Now, in Chapter 11, we will focus on behavioral and emotional support for kittens who have recovered from URIs. Health is not just physical. Emotional well-being and proper socialization are equally important for your kitten's overall development. 1. Understanding emotional impact of illness. Kittens recovering from URIs may experience temporary stress, anxiety, or fear. Illness can make them feel vulnerable, especially if they were isolated or handled frequently for care. These experiences can influence behavior later, potentially leading to shyness, hiding, or fearfulness around humans or other animals. Understanding that recovery is both physical and emotional allows caregivers to provide holistic care that supports confidence, social skills, and mental health. 2. Creating a calm and safe environment. After a URI, kittens benefit from a quiet and predictable environment. Key points include minimizing sudden loud noises, such as vacuuming or shouting, providing safe hiding spots where kittens can retreat when they feel stressed, maintaining a consistent routine for feeding, play, and sleeping, ensuring separate resting areas if multiple cats are present to reduce tension. A calm environment helps kittens regain trust, feel secure, and regain energy for play, exploration, and socialization. 3. Gentle handling and positive interaction. Handling kittens gently is critical. Positive experiences build confidence and reduce the risk of stress-related behavior issues. Tips include: use soft, slow movements when picking up or petting kittens. Speak in a calm, soothing tone. Gradually increase the duration of interaction as the kitten grows more comfortable. Allow kittens to approach humans on their own terms rather than forcing interaction. Positive, low-stress handling encourages kittens to develop trust and prevents long-term fear responses. 4. Reintroducing play and exercise. Play is essential for physical health, mental stimulation, and social development. After recovery, start with short, gentle play sessions to gauge energy levels. Use toys that encourage hunting instincts, such as feather wands or balls. Rotate toys regularly to maintain interest and prevent boredom. Include interactive play with caregivers to strengthen bonding. Gradually increase activity to normal levels, monitoring for fatigue or respiratory stress. Exercise helps maintain a strong immune system and overall well-being. 5. Socialization with other animals. Kittens recovering from URIs may need gradual reintroduction to other pets in the household. Begin with supervised, calm interactions. Observe body language for signs of stress or discomfort. Maintain separate feeding and resting areas initially. Allow kittens to adjust at their own pace. Proper socialization ensures that kittens develop confidence, reduce fearfulness, and integrate smoothly with other pets. 6. Monitoring behavioral changes. After illness, kittens may show subtle behavioral changes, such as increased hiding or reluctance to explore, changes in playfulness or appetite, vocalizing more than usual, indicating anxiety or discomfort. Keep a behavioral journal to track changes over time. Persistent issues may require advice from a veterinarian or a certified animal behaviorist to ensure proper emotional support. 7. Enrichment and mental stimulation. Mental enrichment is as important as physical care. Provide puzzle feeders to encourage problem solving. Use interactive toys to stimulate hunting instincts. Rotate environments safely, such as introducing new rooms gradually. Offer sensory enrichment like safe smells or textures. Mental stimulation reduces stress, prevents boredom, and encourages natural behaviors essential for healthy development. 8. Encouraging independence and confidence. Kittens who recover from URIs may have experienced extra dependence on caregivers. Encouraging independence helps build confidence. Provide spaces for exploration without constant supervision. Allow kittens to interact with toys, climbing structures, and safe outdoor views. Gradually increase the kitten's autonomy while ensuring a safe environment. Confidence-building activities reduce stress and promote emotional resilience. 9. Long-term health and behavior connection. Behavior and emotional health are closely linked to physical health. Stress, anxiety, or poor socialization can weaken the immune system and increase susceptibility to future illnesses. Long-term behavioral support ensures that kittens remain mentally and physically healthy, preventing health complications related to stress. 10. Using positive reinforcement. Positive reinforcement helps shape desirable behaviors while maintaining trust. Reward kittens with treats, praise, or gentle petting for calm behavior. Avoid punishment, which can increase stress and fear. Reinforce healthy eating, socialization, and play patterns consistently. Positive reinforcement strengthens bonding and encourages lifelong good behavior habits. 11. Preparing for lifelong well-being. Behavioral and emotional support should continue throughout the kitten's life. Maintain a stable, enriched environment. Offer ongoing socialization with humans and other pets. Provide regular play and mental stimulation. Monitor behavior for signs of stress or illness. Long-term attention to emotional well-being complements physical care, ensuring kittens thrive as confident, healthy adult cats. 12. Summary and key takeaways. Recovery from a URI extends beyond physical healing. Caregivers should focus on creating a calm, safe, and predictable environment, providing gentle handling and positive interaction, gradually reintroducing play, exercise, and socialization, monitoring behavioral changes and addressing stress or anxiety, encouraging independence and confidence, offering mental enrichment and interactive activities, using positive reinforcement to build trust and desirable behaviors. By addressing both physical and emotional needs, caregivers help kittens achieve optimal overall well-being, reducing the risk of future stress-related health problems and ensuring a happy, thriving life. This concludes Chapter 11 and adds the behavioral and emotional dimension to our comprehensive guide on URIs in kittens. Welcome back to our extended series on upper respiratory infections, URIs, in kittens. In the previous chapters, we have explored causes, symptoms, treatment, recovery, preventive strategies, and behavioral support. In Chapter 12, we focus on how to integrate URI awareness into long-term kitten care plans. By including URI prevention and management in everyday routines, caregivers can ensure that kittens stay healthy, resilient, and thriving throughout their lives. 1. Understanding the importance of long-term planning. Kittens are especially vulnerable to URIs during their first months of life, but susceptibility can continue into adulthood, particularly if the cat experiences stress, environmental changes, or exposure to other animals. A long-term care plan that incorporates URI awareness reduces the risk of reinfection, promotes overall health and resilience, helps caregivers detect early signs of illness, encourages proper vaccination, nutrition, and behavioral care. By proactively planning, caregivers can minimize illness and ensure kittens develop into healthy adult cats. 2. Regular veterinary care as a foundation. Routine veterinary visits are the backbone of any long-term care plan. Key aspects include initial checkups to ensure the kitten is healthy after recovery, vaccination schedules with boosters for URI-related pathogens, wellness exams to monitor growth, nutrition, and overall health, early intervention when signs of illness appear. Regular veterinary oversight ensures that URI prevention is integrated into all aspects of health management. 3. Vaccination and preventive health strategies. A long-term care plan should prioritize vaccination against URI-causing pathogens such as feline herpes virus and calicivirus. Additional preventive strategies include parasite control for fleas, ticks, and intestinal worms, annual wellness exams to detect early disease, monitoring for chronic conditions that could weaken the immune system. Vaccination and preventive care create a strong foundation for lifelong health. 4. Nutrition and immune system support. Long-term health planning must include a nutrition plan. Feed high-quality kitten or adult cat food appropriate for age and activity level. Ensure balanced macronutrients, vitamins, and minerals for immune support. Provide fresh water at all times. Adjust diet as the cat grows, factoring in growth, weight, and activity level. Proper nutrition supports immunity, tissue repair, and overall vitality, reducing susceptibility to URIs. 5. Environmental management and hygiene. Maintaining a healthy environment is critical for long-term URI prevention. Clean litter boxes, bedding, and feeding areas regularly. Disinfect shared toys, surfaces, and grooming tools. Ensure proper ventilation to reduce airborne pathogens. Limit exposure to new or unknown cats until their health status is verified. Environmental hygiene should become a routine habit, incorporated into daily care plans for each kitten or adult cat. 6. Stress management and emotional well-being. Stress is a major factor that can compromise immunity and trigger URIs. Integrating stress management into long-term care involves establishing predictable daily routines, providing safe hiding spots and comfortable resting areas, offering interactive toys and enrichment activities, encouraging gentle socialization with humans and other animals. Reducing stress strengthens immunity and promotes mental health, preventing illness recurrence. 7. Monitoring for recurrence. Even kittens who have fully recovered can experience recurring URI symptoms. Long-term care plans should include daily observation for sneezing, coughing, or nasal/eye discharge, recording any changes in appetite, energy, or behavior, immediate isolation and veterinary consultation if symptoms reappear. Routine monitoring ensures early detection and intervention, limiting severity and spread. 8. Planning for multi-cat households. In households with multiple cats, long-term URI management requires additional considerations. Keep vaccination records up to date for all cats. Isolate new or sick cats temporarily. Maintain multiple feeding and resting areas. Implement rigorous cleaning protocols for shared spaces. These measures reduce cross-infection risks and protect vulnerable kittens and adult cats alike. 9. Incorporating behavioral health. Behavior and emotional well-being directly impact physical health. A comprehensive care plan should include gentle handling and positive reinforcement, interactive play and mental stimulation, gradual introduction to new environments or animals, ongoing monitoring for stress-related behaviors. Supporting emotional health helps maintain a strong immune system and enhances overall quality of life. 10. Record-keeping and health documentation. Maintaining detailed records is vital for long-term care. Track vaccinations, boosters, and vet visits. Record weight, growth, and dietary changes. Note behavioral patterns, play habits, and any illness signs. Document treatments, medications, and response to therapy. Good documentation enables caregivers and veterinarians to make informed decisions and respond quickly to potential health issues. 11. Educating caregivers and family members. A long-term URI-aware care plan includes education for all caregivers, recognizing early signs of illness, following cleaning and hygiene protocols, understanding proper feeding and enrichment techniques, knowing when to seek veterinary intervention. Educated caregivers ensure consistency in care and reduce the risk of infection recurrence. 12. Preparing for life stages and transitions. Kittens grow and their care needs change as they mature into adults. Long-term care planning includes adjusting diet to adult or senior cat requirements, modifying enrichment activities for age and energy levels, continuing preventive care and vaccinations throughout life, monitoring for chronic conditions that may impact immunity. By anticipating changes, caregivers can provide seamless support, maintaining URI prevention and overall health at every life stage. 13. Summary and key takeaways. Integrating URI awareness into long-term kitten care ensures a comprehensive approach to health and well-being. Maintain regular veterinary care and vaccination schedules. Ensure balanced nutrition and proper hydration. Keep a clean, safe, and low-stress environment. Monitor for early signs of illness and recurrence. Support behavioral and emotional health through enrichment and positive interaction. Implement strict hygiene and preventive practices in multi-cat households. Maintain detailed health records. Educate all caregivers and plan for transitions across life stages. By embedding URI awareness into everyday routines, caregivers can protect their kittens, promote long-term health, and ensure that recovered kittens thrive physically, mentally, and emotionally throughout their lives. This concludes Chapter 12 and the final installment in our extended series on URIs in kittens. With careful planning, attentive care, and proactive prevention, kittens can enjoy a healthy, happy, and resilient life long after recovery. Welcome back to our extended series on upper respiratory infections, URIs, in kittens. In the previous chapters, we explore the causes, symptoms, treatment, recovery, long-term management, and behavioral support for kittens recovering from URIs. In Chapter 13, we expand the scope to community and public health considerations, exploring how individual care, shelter management, and public awareness play a crucial role in preventing the spread of URIs among kittens and cats. 1. Understanding URIs as a community health concern. While URIs are common in individual kittens, they can become a community-level concern, especially in areas with high populations of stray or shelter kittens. Outbreaks in shelters, foster networks, or multi-cat households can quickly spread to other cats if not properly managed. Public health awareness is essential to reduce the spread of infection among populations, promote responsible pet ownership, encourage vaccination and preventive care, minimize the need for emergency veterinary interventions. Recognizing URIs as a broader health issue helps caregivers, veterinarians, and communities work together to keep kittens healthy. 2. Shelter management and infection control. Shelters often house large numbers of kittens, making infection control protocols critical. Isolation of sick kittens to prevent cross-contamination. Strict hygiene measures, including daily disinfection of cages, feeding equipment, and litter boxes. Health screening of incoming kittens for signs of URIs or other illnesses. Staff training on recognizing early symptoms, handling, and cleaning protocols. Effective shelter management not only protects resident kittens but also safeguards public health by reducing the risk of disease spread when kittens are adopted. 3. Fostering programs and home-based care. Foster homes play a vital role in the rescue and care of kittens. Proper URI prevention in these settings involves educating foster caregivers about early symptom recognition and isolation, ensuring kittens are up to date on vaccinations before and during foster care, providing clear guidelines on hygiene, feeding, and environmental management, monitoring kittens' health and communicating promptly with veterinarians. Foster programs that emphasize URI prevention reduce the risk of community outbreaks and protect vulnerable populations. 4. Vaccination campaigns and public awareness. Community-level vaccination campaigns are essential in areas with high numbers of unvaccinated or stray kittens. Key strategies include hosting low-cost or free vaccination clinics, educating the public about the importance of core vaccines, promoting responsible pet ownership, including spaying/neutering and routine veterinary care, using social media, newsletters, and local events to raise awareness about URI prevention. By increasing vaccination coverage, communities can create herd immunity and reduce the prevalence of URIs among kittens and adult cats. 5. Reducing stress and overcrowding in public spaces. Overcrowding in shelters, community cat colonies, or multi-cat environments increases stress and the risk of URIs. Community health strategies should include encouraging adoption and foster programs to reduce shelter crowding, providing guidelines for safe handling and socialization of kittens in public spaces, supporting trap-neuter return (TNR) programs for community cats to reduce density. Stress reduction is key to both individual kitten health and broader public health outcomes. 6. Collaboration between veterinarians and caregivers. Veterinarians serve as a crucial link between individual kitten care and community health. Collaboration can include developing protocols for URI prevention in shelters and foster homes, offering guidance on treatment, vaccination, and isolation procedures, educating caregivers about early symptom recognition and proper handling. Strong partnerships between veterinary professionals, shelters, and foster caregivers create a network of knowledge that protects kittens at both individual and community levels. 7. Public education on early recognition and reporting. Educating the public about early signs of URIs ensures prompt action and prevents spread. Sneezing, nasal or eye discharge, coughing, and lethargy should be recognized as potentially contagious symptoms. Caregivers should seek veterinary care quickly rather than ignoring mild signs. Awareness campaigns can include posters, flyers, workshops, and online content. Early recognition by responsible pet owners helps contain infections before they escalate. 8. Strategies for multi-cat households in the community. Many kittens grow up in homes with multiple cats, which can act as micro-communities. Maintain vaccination records for all cats. Use separate feeding, water, and litter stations to minimize contact and spread. Isolate newly adopted or sick cats temporarily. Implement rigorous cleaning protocols for shared spaces. By applying community-based principles at the household level, caregivers contribute to broader URI prevention efforts. 9. Tracking and reporting URI cases. Community health initiatives can benefit from tracking and reporting URI outbreaks. Shelters and veterinary clinics can maintain records of cases, treatments, and outcomes. Data can inform vaccination strategies, public education campaigns, and resource allocation. Sharing information within networks of shelters, foster homes, and veterinarians improves overall preparedness. Knowledge sharing ensures a coordinated response to potential outbreaks. 10. Responsible adoption practices. When kittens recover from URIs and are ready for adoption, responsible adoption practices are vital. Educate new owners about URI prevention, vaccination, and hygiene. Provide clear instructions on monitoring for early symptoms. Encourage follow-up veterinary care to ensure continued immunity and health. Responsible adoptions protect both the kittens and the broader community of cats. 11. Public health and zoonotic considerations. Although most feline URIs are not directly transmissible to humans, proper hygiene is still important. Wash hands after handling kittens, especially those with recent infections. Clean feeding and litter areas thoroughly. Avoid direct contact with sick animals if immune-compromised. Awareness of general hygiene protects human health while maintaining kitten well-being. 12. Summary and key takeaways. Community and public health considerations are essential for long-term URI prevention. Recognize URIs as a community health concern. Implement strict infection control in shelters and foster homes. Promote vaccination campaigns and public awareness. Reduce stress and overcrowding in communal settings. Foster collaboration between veterinarians, shelters, and caregivers. Educate the public on early recognition and responsible care. Track and report URI cases to inform prevention strategies. Apply responsible adoption and household practices to prevent spread. By integrating URI awareness into community and public health strategies, caregivers, shelters, and veterinary professionals can significantly reduce the prevalence of URIs, protect vulnerable kittens, and promote a healthier environment for all cats. This concludes Chapter 13 and adds the community and public health perspective to our comprehensive guide on URIs in kittens. With these strategies, individual care, shelter management, and public education work together to safeguard the health of kittens and cats across the United States. Welcome back to our extended series on upper respiratory infections, URIs, in kittens. In the previous chapters, we discussed everything from causes, symptoms, treatment, long-term care, behavioral support, and community considerations. In Chapter 14, we focus on emergency response and crisis management for kittens experiencing severe URI cases. While most URIs are mild and manageable at home, some kittens, especially neonates, high-risk individuals, or those in crowded environments, may develop life-threatening complications. Being prepared for emergencies is essential for caregivers, foster homes, and veterinary teams. 1. Understanding severe URI cases. Severe URIs in kittens can escalate rapidly, leading to dehydration due to reduced appetite or vomiting, labored breathing from nasal congestion or secondary infections, high fever or hypothermia indicating systemic infection, eye or ear infections as complications of untreated URIs, sepsis or systemic illness in extreme cases. Recognizing the difference between mild and severe cases is crucial. Any kitten showing rapid deterioration or distress should be treated as an emergency. 2. Early warning signs of crisis. Prompt identification of severe cases can save lives. Key warning signs include persistent labored or noisy breathing, blue or pale gums indicating oxygen deprivation, severe lethargy, weakness, or inability to stand, continuous sneezing or nasal discharge with blood or pus, refusal to eat or drink for more than a few hours, dehydration signs, sunken eyes, dry gums, poor skin elasticity. Immediate veterinary intervention is critical when these symptoms appear. 3. Preparing an emergency kit. All caregivers and foster homes should maintain a kit for URI emergencies, including thermometer for monitoring body temperature, syringes or feeding bottles for assisted nutrition, saline nasal drops to ease congestion, humidifier or steam source for respiratory relief, clean towels, blankets, and heat pads for warmth. Contact information for veterinarians and emergency clinics. Having a ready kit reduces response time and increases the likelihood of a positive outcome. 4. Immediate first aid measures. While waiting for veterinary care, caregivers can implement basic first aid. Keep the kitten warm using blankets or heat pads, ensuring there is space to move if overheated. Maintain hydration, offering water or electrolyte solutions carefully. Use saline drops or gentle steam to relieve nasal congestion. Ensure the kitten is in a quiet, stress-free environment. Handle the kitten gently and minimally to reduce energy expenditure. These measures stabilize the kitten until professional care is available. 5. Veterinary intervention and hospitalization. Severe URIs often require veterinary hospitalization, which may include oxygen therapy for kittens struggling to breathe, intravenous or subcutaneous fluids to combat dehydration, antibiotics or antivirals for secondary bacterial or viral infections, nutritional support through feeding tubes if kittens cannot eat independently, monitoring of vital signs including temperature, heart rate, and respiratory rate. Early intervention in a clinical setting greatly improves the survival rate for severe cases. 6. Isolation and infection control during emergencies. During crises, kittens are highly contagious. Caregivers must isolate sick kittens from other cats immediately. Wear gloves and protective clothing when handling. Clean and disinfect all surfaces, feeding equipment, and bedding. Limit contact to essential personnel only. These practices prevent secondary infections and reduce the risk of outbreaks in multi-cat environments or shelters. 7. Communication and coordination. Effective crisis management involves clear communication with veterinarians for guidance and treatment instructions, shelter or foster coordinators if the kitten is part of a larger network, family members or caregivers for consistent care. Having a crisis communication plan ensures that all involved parties understand responsibilities, medical protocols, and emergency procedures. 8. Post-emergency care and monitoring. After stabilization, kittens require intensive post-emergency care. Continue medications as prescribed, including antibiotics or antivirals. Gradually reintroduce normal feeding routines, monitoring intake and weight. Maintain a warm, clean, and low-stress environment. Monitor respiratory function and other vital signs for recurrence of symptoms. Close observation during recovery prevents relapse and supports long-term health. 9. Documentation and lessons learned. After a severe URI incident, documenting the case is crucial. Record symptoms, treatments, and response times. Note environmental conditions and potential triggers. Evaluate what measures were effective and what could improve. Share findings with veterinary teams or shelter networks to enhance future preparedness. Thorough documentation helps improve emergency response strategies for other kittens in the future. 10. Training for caregivers and volunteers. Preparedness is enhanced through training. Recognizing early warning signs of severe URI. Administering first aid safely. Handling kittens without causing additional stress. Understanding when to escalate care to veterinary professionals. Training programs in shelters, foster networks, and public outreach initiatives improve survival rates and overall kitten welfare. 11. Preventing recurrences through long-term planning. Following an emergency, caregivers should incorporate lessons into long-term care. Maintain regular veterinary checkups and vaccination schedules. Improve hygiene and environmental management. Implement behavioral and stress reduction strategies. Monitor for early signs of URI recurrence and respond promptly. Proactive long-term planning reduces the likelihood of future emergencies. 12. Summary and key takeaways. Severe URIs in kittens require a structured and rapid response. Recognize early warning signs and assess severity. Keep an emergency kit readily available. Implement first aid measures while seeking veterinary care. Ensure proper isolation and infection control. Communicate effectively with veterinarians and caregivers. Provide post-emergency intensive care and monitoring. Document cases and incorporate lessons into long-term planning. Train all caregivers and volunteers to recognize and manage crises. Preparedness, vigilance, and rapid action can make the difference between life and death for kittens facing severe URIs. By combining emergency response strategies with long-term preventive care, caregivers can maximize survival, reduce stress, and support recovery, ensuring kittens have the best chance for a healthy, thriving life. Welcome back to the final chapter of our extended series on upper respiratory infections, URIs, in kittens. In the previous chapters, we covered causes, symptoms, treatment, recovery, long-term management, behavioral support, community considerations, and emergency response. In Chapter 15, we explore the future of URI management, highlighting ongoing research, innovative therapies, and emerging trends that promise to improve kitten health and care outcomes across the United States and worldwide. 1. The importance of research in URI prevention and treatment. Continuous research is vital because URIs remain a common and persistent challenge in kittens. New viral strains, bacterial resistance, and environmental factors require ongoing scientific investigation. Research areas focus on understanding the pathogenesis of URI pathogens, developing more effective vaccines and antiviral therapies, exploring immune system development in kittens, assessing environmental and behavioral factors that influence susceptibility. By staying informed about research findings, caregivers and veterinarians can apply evidence-based strategies to prevent and manage URIs more effectively. 2. Advances in vaccination technology. Vaccination remains the cornerstone of URI prevention. Future advances include improved vaccines with broader coverage against multiple strains of herpes virus and calicivirus, non-invasive or oral vaccines, reducing stress during administration, vaccines designed for faster immunity development in neonates and young kittens, long-lasting immunity, potentially reducing the need for frequent boosters. These innovations aim to increase vaccination compliance, reduce stress for kittens, and improve overall population immunity. 3. Antiviral and adjunct therapies. Traditional URI management relies on supportive care and antibiotics for secondary infections. Future therapies may include targeted antiviral medications for specific viral pathogens, immunomodulatory agents to enhance natural immune responses, topical treatments for nasal or ocular symptoms to reduce systemic stress, probiotics and microbiome interventions that support respiratory and gut health. Such therapies could shorten recovery times, reduce complications, and improve quality of life for kittens with severe or recurrent URIs. 4. Genetic and immunological research. Recent studies suggest that some kittens are genetically more susceptible to URIs due to immune system variations. Advances in genetics and immunology may enable identification of high-risk kittens early in life, personalized preventive care plans tailored to individual immune profiles, development of gene-targeted therapies to enhance resistance, insights into how environmental and hereditary factors interact to influence susceptibility. These breakthroughs could revolutionize the way caregivers and veterinarians approach URI prevention and long-term health planning. 5. Telemedicine and digital monitoring. Digital health tools are increasingly used in veterinary care. For URIs, emerging technologies include telemedicine consultations for early symptom assessment, mobile apps to track feeding, hydration, and respiratory symptoms, remote monitoring devices that record temperature, respiratory rate, and activity, digital reminders for vaccination schedules, medications, and follow-ups. These tools empower caregivers to detect problems early, reduce emergency visits, and maintain consistent long-term care. 6. Environmental innovations for URI prevention. Environmental management plays a key role in URI prevention. Innovative approaches include advanced air filtration systems to reduce airborne pathogens, smart cleaning protocols and disinfectants designed for multi-cat environments, enrichment devices that reduce stress and promote mental health, IoT-enabled monitors for temperature, humidity, and air quality. By combining technology with proper hygiene and enrichment, kittens are less likely to contract URIs, and multi-cat households can maintain safer environments. 7. Behavioral and socialization research. Future research is increasingly recognizing the link between behavioral health and immunity. Studies on how stress reduction improves resistance to respiratory infections, development of behavioral enrichment protocols tailored to URI-prone kittens, identification of socialization strategies that minimize stress while promoting healthy interaction. Behavioral science and immunology together are creating more holistic approaches to URI management. 8. Community health and epidemiology studies. At the population level, epidemiological studies aim to map URI prevalence and outbreak patterns in shelters and urban areas, identify risk factors associated with multi-cat environments, develop community-level vaccination and hygiene strategies, inform policy and public health initiatives to reduce URI incidence. Community-based research ensures that lessons learned benefit not just individual kittens but broader populations. 9. Integrating One Health principles. The One Health approach emphasizes the interconnectedness of human, animal, and environmental health. In URI management, this includes monitoring how environmental changes affect disease spread in cats, educating caregivers on safe hygiene practices that protect both humans and animals, collaborating across veterinary, public health, and research organizations, using data-driven strategies to improve outcomes for both animals and communities. One Health integration ensures a comprehensive and sustainable approach to URI prevention and management. 10. Preparing caregivers for future innovations. As science and technology advance, caregivers should stay informed about new vaccines, therapies, and monitoring tools. Implement best practices for hygiene, nutrition, and enrichment. Engage with veterinary teams and shelter networks to adopt emerging strategies. Advocate for responsible pet ownership and community health initiatives. Educated and proactive caregivers are essential to successfully applying innovations in everyday kitten care. 11. Key takeaways and vision for the future. Future research and innovation promise a world where URIs in kittens are better prevented, more effectively treated, and less stressful for both kittens and caregivers. Key points include advanced vaccines and antiviral therapies to reduce incidence and severity, genetic, immunological, and behavioral insights to personalize care, digital tools and telemedicine for early detection and consistent monitoring, environmental and community strategies to minimize outbreaks, integration of One Health principles for sustainable, population-level impact. By embracing these advances, caregivers, veterinarians, and shelters can collectively ensure that kittens lead healthier, happier, and longer lives free from the stress and complications of URIs. 12. Conclusion. Chapter 15 concludes our comprehensive series on upper respiratory infections in kittens. The future of URI management is bright, driven by science, innovation, and community collaboration. By staying informed, proactive, and compassionate, caregivers can apply emerging knowledge to enhance kitten care, improve outcomes, and promote resilience. URIs may be common, but with research-backed strategies and long-term planning, kittens can thrive and enjoy healthy lives across all stages of development. Welcome back to our extended series on upper respiratory infections, URIs, in kittens. In the previous chapters, we explored causes, symptoms, treatment, long-term care, behavioral support, community considerations, emergency response, and future innovations. In Chapter 16, we focus on developing comprehensive educational resources for caregivers, enabling them to manage URIs effectively and promote the long-term health of kittens. Education is a key tool for prevention, early detection, and proper care, empowering caregivers to act confidently and proactively. 1. The role of education in URI prevention and management. Caregiver education is critical because many kittens develop URIs due to lack of knowledge or delayed interventions. Proper education empowers caregivers to recognize early signs of illness before it becomes severe, understand appropriate hygiene and environmental protocols, administer medications and supportive care correctly, promote mental and emotional well-being alongside physical recovery. By providing caregivers with comprehensive guidance, we reduce stress for both kittens and humans while improving health outcomes. 2. Identifying the target audience. Educational resources should be tailored to the diverse group of caregivers. New kitten owners or first-time pet parents, foster caregivers and volunteers in shelters, families with multiple pets or community cat involvement, veterinary professionals looking for educational materials for clients. Understanding the audience ensures the resources are accessible, relevant, and actionable, increasing the likelihood of proper implementation. 3. Core topics to cover. Comprehensive educational resources should include understanding URIs, causes, transmission, and risk factors, recognizing symptoms, early signs, severity levels, and when to seek help, treatment options, supportive care, medications, hydration, nutrition, preventive measures, vaccination, hygiene, environmental management, behavioral and emotional support, reducing stress, promoting play, socialization, emergency preparedness, first aid, emergency kits, and veterinary intervention, long-term care, monitoring, records, and preventive strategies, community considerations, shelter protocols, fostering, and public health awareness. A well-rounded curriculum ensures caregivers are equipped to handle every aspect of URI management. 4. Formats for educational resources. Different caregivers benefit from various learning formats. Written guides, step-by-step manuals, pamphlets, and checklists. Infographics and visual aids, clear depictions of symptoms, treatments, and preventive measures. Video tutorials, demonstrating feeding techniques, administering medications, and environmental setup. Interactive workshops, hands-on training for foster caregivers and volunteers. Digital platforms, mobile apps, websites, and e-learning modules for remote access. By offering multiple formats, caregivers can engage with content in ways that suit their learning style and lifestyle. 5. Emphasizing accessibility and clarity. Educational materials must be written in clear, simple language suitable for non-professionals, inclusive and culturally sensitive for a diverse U.S. audience, structured with step-by-step guidance, bullet points, and key takeaways, supported by visual examples, diagrams, or video demonstrations. Accessibility ensures that caregivers of all backgrounds can understand and implement best practices effectively. 6. Incorporating behavioral guidance. Behavioral education is often overlooked but essential. Resources should teach caregivers to recognize stress indicators in kittens, implement gentle handling and positive reinforcement techniques, encourage interactive play and socialization, provide safe spaces for rest and recovery. Integrating behavioral education alongside medical guidance ensures holistic care that promotes both physical and emotional well-being. 7. Encouraging preventive mindsets. Educational resources should emphasize prevention over reaction, maintaining vaccination schedules and boosters, practicing consistent hygiene in multi-cat households, reducing stress and environmental risk factors, monitoring for early signs of illness and responding promptly. Instilling a preventive mindset in caregivers reduces the likelihood of severe infections and improves long-term kitten health. 8. Engaging caregivers through interactive learning. Engagement enhances retention and practical application. Strategies include quizzes and checklists to reinforce learning, scenario-based exercises for emergency response, discussion forums or support groups for shared experiences and advice, feedback mechanisms to allow caregivers to ask questions and receive guidance. Interactive elements build confidence, problem-solving skills, and preparedness among caregivers. 9. Collaboration with veterinary professionals. Developing educational resources benefits greatly from collaboration with veterinarians. Ensures accuracy and evidence-based recommendations. Provides professional oversight for complex medical guidance. Facilitates distribution through clinics, shelters, and online platforms. Allows for updates as new research or best practices emerge. Veterinary input ensures that caregivers receive the most current and reliable guidance available. 10. Evaluating resource effectiveness. It is important to assess whether educational materials achieve their goals. Conduct surveys to measure caregiver knowledge before and after using the resources. Monitor behavioral changes and implementation of best practices. Track outcomes in kittens, such as reduced URI incidents or faster recovery. Gather feedback for continuous improvement. Evaluation ensures resources remain practical, effective, and responsive to caregiver needs. 11. Leveraging technology for broader impact. Technology can amplify the reach and impact of educational programs. Mobile apps with interactive tutorials, reminders, and symptom tracking. Online webinars and live Q&A sessions with veterinarians. Social media campaigns highlighting tips, preventive measures, and success stories. Digital distribution of guides, checklists, and videos for remote access. Technology ensures caregivers nationwide have access to quality information regardless of location. 12. Building a supportive community. Education is most effective when paired with community support. Online forums or social media groups for caregivers to share experiences. Local workshops or support networks facilitated by shelters or veterinary clinics. Mentorship programs where experienced caregivers guide new kitten owners. A supportive network encourages consistent application of best practices, reinforces learning, and reduces caregiver stress. 13. Summary and key takeaways. Creating comprehensive educational resources empowers caregivers to manage URIs in kittens effectively. Provide clear, evidence-based guidance covering prevention, treatment, and behavioral support. Use diverse formats, including written guides, videos, workshops, and digital tools. Emphasize clarity, accessibility, and interactive learning. Collaborate with veterinary professionals to ensure accuracy. Foster community support and ongoing engagement. Evaluate effectiveness and update resources based on feedback and research. Well-designed educational resources ensure that caregivers are informed, confident, and proactive, ultimately leading to healthier kittens, fewer complications, and a stronger overall kitten care ecosystem. 14. Conclusion. Chapter 16 concludes the discussion on creating effective educational strategies for URI management. Empowering caregivers through knowledge, tools, and community support strengthens kitten health outcomes and reduces the prevalence and severity of upper respiratory infections. With informed, proactive, and confident caregivers, kittens can enjoy long, healthy, and resilient lives, free from preventable illness and stress. Welcome back to our extended series on upper respiratory infections, URIs, in kittens. In the previous chapters, we explored causes, symptoms, treatment, long-term care, behavioral support, community considerations, emergency response, and future innovations. In Chapter 16, we focus on developing comprehensive educational resources for caregivers, enabling them to manage URIs effectively and promote the long-term health of kittens. Education is a key tool for prevention, early detection, and proper care, empowering caregivers to act confidently and proactively. 1. The role of education in URI prevention and management. Caregiver education is critical because many kittens develop URIs due to lack of knowledge or delayed interventions. Proper education empowers caregivers to recognize early signs of illness before it becomes severe. Understand appropriate hygiene and environmental protocols. Administer medications and supportive care correctly. Promote mental and emotional well-being alongside physical recovery. By providing caregivers with comprehensive guidance, we reduce stress for both kittens and humans while improving health outcomes. 2. Identifying the target audience. Educational resources should be tailored to the diverse group of caregivers. New kitten owners or first-time pet parents, foster caregivers and volunteers in shelters, families with multiple pets or community cat involvement, veterinary professionals looking for educational materials for clients. Understanding the audience ensures the resources are accessible, relevant, and actionable, increasing the likelihood of proper implementation. 3. Core topics to cover. Comprehensive educational resources should include understanding URIs, causes, transmission, and risk factors, recognizing symptoms, early signs, severity levels, and when to seek help, treatment options, supportive care, medications, hydration, nutrition, preventive measures, vaccination, hygiene, environmental management, behavioral and emotional support, reducing stress, promoting play, socialization, emergency preparedness, first aid, emergency kits, and veterinary intervention. Long-term care, monitoring, records, and preventive strategies. Community considerations, shelter protocols, fostering, and public health awareness. A well-rounded curriculum ensures caregivers are equipped to handle every aspect of URI management. 4. Formats for educational resources. Different caregivers benefit from various learning formats. Written guides, step-by-step manuals, pamphlets, and checklists. Infographics and visual aids, clear depictions of symptoms, treatments, and preventive measures. Video tutorials, demonstrating feeding techniques, administering medications, and environmental setup. Interactive workshops, hands-on training for foster caregivers and volunteers. Digital platforms, mobile apps, websites, and e-learning modules for remote access. By offering multiple formats, caregivers can engage with content in ways that suit their learning style and lifestyle. 5. Emphasizing accessibility and clarity. Educational materials must be written in clear, simple language suitable for non-professionals, inclusive and culturally sensitive for a diverse U.S. audience, structured with step-by-step guidance, bullet points, and key takeaways, supported by visual examples, diagrams, or video demonstrations. Accessibility ensures that caregivers of all backgrounds can understand and implement best practices effectively. 6. Incorporating behavioral guidance. Behavioral education is often overlooked but essential. Resources should teach caregivers to recognize stress indicators in kittens, implement gentle handling and positive reinforcement techniques, encourage interactive play and socialization, provide safe spaces for rest and recovery. Integrating behavioral education alongside medical guidance ensures holistic care that promotes both physical and emotional well-being. 7. Encouraging preventive mindsets. Educational resources should emphasize prevention over reaction, maintaining vaccination schedules and boosters, practicing consistent hygiene in multi-cat households, reducing stress and environmental risk factors, monitoring for early signs of illness and responding promptly. Instilling a preventive mindset in caregivers reduces the likelihood of severe infections and improves long-term kitten health. 8. Engaging caregivers through interactive learning. Engagement enhances retention and practical application. Strategies include quizzes and checklists to reinforce learning, scenario-based exercises for emergency response, discussion forums or support groups for shared experiences and advice, feedback mechanisms to allow caregivers to ask questions and receive guidance. Interactive elements build confidence, problem-solving skills, and preparedness among caregivers. 9. Collaboration with veterinary professionals. Developing educational resources benefits greatly from collaboration with veterinarians. Ensures accuracy and evidence-based recommendations. Provides professional oversight for complex medical guidance. Facilitates distribution through clinics, shelters, and online platforms. Allows for updates as new research or best practices emerge. Veterinary input ensures that caregivers receive the most current and reliable guidance available. 10. Evaluating resource effectiveness. It is important to assess whether educational materials achieve their goals. Conduct surveys to measure caregiver knowledge before and after using the resources. Monitor behavioral changes and implementation of best practices. Track outcomes in kittens, such as reduced URI incidents or faster recovery. Gather feedback for continuous improvement. Evaluation ensures resources remain practical, effective, and responsive to caregiver needs. 11. Leveraging technology for broader impact. Technology can amplify the reach and impact of educational programs. Mobile apps with interactive tutorials, reminders, and symptom tracking. Online webinars and live Q&A sessions with veterinarians. Social media campaigns highlighting tips, preventive measures, and success stories. Digital distribution of guides, checklists, and videos for remote access. Technology ensures caregivers nationwide have access to quality information regardless of location. 12. Building a supportive community. Education is most effective when paired with community support. Online forums or social media groups for caregivers to share experiences. Local workshops or support networks facilitated by shelters or veterinary clinics. Mentorship programs where experienced caregivers guide new kitten owners. A supportive network encourages consistent application of best practices, reinforces learning, and reduces caregiver stress. 13. Summary and key takeaways. Creating comprehensive educational resources empowers caregivers to manage URIs in kittens effectively. Provide clear, evidence-based guidance covering prevention, treatment, and behavioral support. Use diverse formats, including written guides, videos, workshops, and digital tools. Emphasize clarity, accessibility, and interactive learning. Collaborate with veterinary professionals to ensure accuracy. Foster community support and ongoing engagement. Evaluate effectiveness and update resources based on feedback and research. Well-designed educational resources ensure that caregivers are informed, confident, and proactive, ultimately leading to healthier kittens, fewer complications, and a stronger overall kitten care ecosystem. 14. Conclusion. Chapter 16 concludes the discussion on creating effective educational strategies for URI management. Empowering caregivers through knowledge, tools, and community support strengthens kitten health outcomes and reduces the prevalence and severity of upper respiratory infections. With informed, proactive, and confident caregivers, kittens can enjoy long, healthy, and resilient lives, free from preventable illness and stress.